Let's say you've had a heart surgery. The doctor performing that surgery gets far more, 20 times more, than just a general practitioner who might talk to you about lifestyle changes that could also impact your health. It's all due to medical billing codes that not only have an effect on the healthcare industry, but the level of care that you, the patient, receive. Remember this term, RVU. It stands for Relative Value Unit. In short, it's the metric used to evaluate the time, complexity, and skill it takes for a doctor to perform a procedure. And for decades, RVUs have been the cornerstone of how physicians are paid.
It's a serious problem. 70 to 80% of physician pay is dependent upon these RVUs.
Dr. Ezekiel Emanuel is an MD, a professor at UPenn, and a leading expert in the healthcare field. As we said, RVUs have been the cornerstone of how doctors are paid. The thing is, those RVUs have been set for decades by the American Medical Association, which relies heavily on an advisory board of 32 physicians and other healthcare professionals. While the board's recommendations are not binding, it has led to criticisms that the physicians have a conflict of interest since they essentially recommend their own pay. It has also led to accusations that the system drives doctors to become specialists because they will be paid more, leaving little incentive for some of the best medical minds to go into the primary care.
To make what a cardiac surgeon makes from one operation, a primary care doctor has to see 23 patients. Well, why are they rushing? Well, that's why they're rushing.
As Dr. Emanuel notes, it can affect patient care. Some policymakers have spent years warning of these billing codes and skewed incentives. But the issue has received little attention due to its complexity and industry groups that are accustomed to how payments are set. In 2013, the Washington Post did an investigation that found the advisory board for the AMA that recommends RVUs repeatedly inflated the amount of time a doctor needed to perform a procedure. It also found the American Medical Association overwhelmingly accepted the recommendations.
Changing a system like this is hard. RFK at least understands this is a problem.
Dan Grossman, Scripps News, Denver.